welcome to the Injury Report on ESPN760.com. Steve Politziner, Dr. Jonathan Cutler, of course, from the South Florida Foot and Ankle Centers, back again for another show, Doc.
Number two, and I'm really excited about today. We have a great guy, Dr. Jeffrey Rosenfield, who's been in town for a while, and I've seen many of his post-operative surgeries, and people just do phenomenal. So I'm really excited about learning all about the whole upper extremity, the shoulder, the elbow, and the hand.
And if you're new to the show, of course, we're going to talk about everything from injuries that the top professional athletes face all the way down to the weekend warrior. We all experience them one way or the other. If you're a fan of a team, you want to know when your guy's coming back. Perhaps you like to wager with your friends. You might want to know when your player will be returning. Maybe you have a fantasy team. Or if you're like many of us, you want to go out, you want to play on the weekends, and when you get injured, you want to know what the recovery is going to be, but also the preventative measures that you can take, and that's one of the real things that we like to delve into on the show, John.
Well, today, a lot of times with a high school athlete, even with I have a 10-year-old, he comes in for Little League. How much does this kid throw? 100 pitches, 80 pitches, 60 pitches? I really don't understand that whole issue because I know he throws like 200 pitches every day just by himself.
And when should they start throwing curveballs?
Right.
And all of those things. Yeah, these are all of the questions and more that we're going to want to have answered. And we're lucky to have right now Dr. Jeffrey Rosenfield. He'd been practicing in the area for a long time, originally from Los Angeles. And as you mentioned, for those of us that in layman's terms, it's shoulders, it's elbows, it's hands, it's wrists. And we really appreciate that you gave us some time today, Doc.
My pleasure. I'm very glad to be here. Thank you.
Now, are you usually introduced that way at medical conferences? Shoulders, wrists, hands?
It all works. The upper extremity from soup to nuts.
Great. Now, you are a sports enthusiast yourself, so it probably helps that you pay a little close attention to some of the major athletes and the injuries that go on a week-to-week basis across all sports.
Absolutely. Keep a close eye on that stuff.
Do you see trends like right now there seems to be a lot more talk in certain injuries like this triceps tear that Ray Lewis recently had that it seems like a lot of NFL players are having that are putting them out for an extended period of time. Is there a reason why this would be more of a common injury that we're hearing about right now?
Well, actually, it's compared to other injuries, it's more of the uncommon injury, but I can see the trend, upticking lately. A lot of that has to do with the level of play and the competition that's out there and trying to stay one up on the competition. Ray Lewis has been around a while. He's a little bit on the NFL side. Yep. He's a little mature, and he's got to compete with these 20 and 21-year-olds that are coming out that are bigger, stronger, and faster, who have had their programs where they went to college. As the trend there. Big giant gymnasiums now with tremendous resources, which they might not have had 15 or 20 years ago when some of these older guys were going through college. So the athletes are getting bigger and stronger. The competition's getting fiercer. So a lot of them are doing stuff to keep up that are putting their tendons and their joints in great peril and harm's way. And it doesn't take much. If one freight train hitting another freight train, something's going to happen. And unfortunately, it's going to be the older guy who's probably going to bear the brunt. The triceps tear that Ray Lewis has, again, is not a common injury, but I can see that trend probably upticking in the next few years, just like the Little League elbow or the Tommy John surgery that you might have heard of 15 or 20 years ago. It's now part of common conversation with everybody.
So with Ray Lewis, Steve was mentioning about people who wager, which I know nothing about, or fantasy lovers. Is he coming back at his age? Obviously you don't know the exact injury per se, but someone of his age with that type of severity, what's your opinion on if this guy's going to play again at that same level?
From my experience, I've treated a few of these injuries, not at that high of a level of an athlete, but certainly an athlete. It's usually an athlete's injury, usually muscular gentlemen who are really strong and they're just pushing against resistance and the tricep snaps. He's in for probably about a 6-month recovery. You got to repair the tendon back to bone. There's a few ways to do that. We won't get into technical specifics, but once you bring that tendon back to the bone, you have to protect it for a few months, and then you got to rehab it. So it's a season-ending injury, but he will be back next year if he stays in shape, and he should be able to perform very close to his previous level of function once it heals. as long as he's protected during the time that it takes to heal. So I bet you he's coming back. He'll come back whatever he was expected to do next year, at least 90% of that, which is probably 150% of the rest of the league at his level. And I think he'll still have some good years left in that elbow once it's fixed.
Dr. Rosenfield with us, and it's really fascinating that we're starting off with this because we all then think about how does this affect ourselves. I think we watch a baseball player throw 100 miles an hour for 15 years, 200 innings. We can understand why their arm might be damaged, but this triceps injury seems like it's something that can just happen. Break it down all the way to a local level. Is this are we or myself, Dr. Cutler, you, when you're out on the weekend playing sports, is this something that we would be more susceptible to now? And what would be the preventative measures for those that want to certainly avoid this?
All right, well, let's flip it around a little bit. The triceps is the other side of the biceps, if you will. A biceps rupture at that part of the elbow is very common, much more common than the triceps. We can talk about both. The biceps injury is extremely common in the weekend warrior. It's the 40-something-year-old male who is pushing hard against resistance. They may have had a little bit of elbow pain before the injury. They kind of blew it off. They took some anti-inflammatory medication and rested it a little bit, but not much because they want to play in the softball game next Tuesday. And so you can think of those two injuries as sort of two parts of a whole around the elbow. So to prevent them, a lot of times what you need to do is give it a good dedicated rest. If you have symptoms of pain in the elbow, and it might be tendon-related, a dedicated rest is tantamount and the first step to giving yourself a chance to recover without eventually becoming the one that has the rupture. Anti-inflammatory medications are a mainstay of orthopedic treatment. Of course, check with your doctor if it's okay to take those because some of them are over-the-counter, but they still have side effects. Icing and doing some rehab where you strengthen the muscle around the joint to try to offload the stress on the tendon. So there are some measures you can take to try to prevent that injury, but unfortunately, the force that it takes to cause those injuries are sometimes unavoidable. And what it is it's usually a push against resistance. We call it an isometric contraction. And what happens is your muscle's pulling, but your joint's not going anywhere, so the tendon ruptures off the bone. Again, it's a very common injury in the sort of middle age ranges, in the 40s and 50-year-old athlete who wants to stay at the top level of their game, but their bodies, unfortunately, don't hear the message. And so they are usually pushing the limit. And they may have already had some symptoms beforehand, so it's very important to try to prevent it. And there are those measures that you can take to prevent those injuries.
Yeah, it's interesting, too. If we feel, it sounds like the limits they're pushing are certainly above and beyond the average guy. But if the average person is feeling something, in their elbow, it could ultimately lead to some, form of a rupture. I think the average man who I sort of represent here, John, might also think a little bit, well, when you start to put that amount of mass on your bodies, and again, not saying anything specific about Ray Lewis who we're talking about, but there's always the perception that, there are players have used a lot of illegal aids to grow beyond what their bodies would naturally allow. Would everything we're talking about that you deal with, would those be categories or areas where it would be more typical for players to experience those sort of injuries if they are using drugs, anabolic steroids, things that are outlawed by leagues?
Absolutely. And then Dr. Cutler can probably chime in, too, on his experience with Achilles ruptures and other tibial tendon ruptures where steroid use is a very, very known culprit of tendon rupture.
Can you guys tell when you go in? Like, could you say this looks like it could have been steroid related, or do you just look at the guy, the rest of the body?
Yeah, typically you can't see it on a local basis like that, unless there's sometimes an iatrogenic on different levels where someone gives a cortisone injection to a tendon, which really shouldn't be done because that could lead to that rupture. But I don't think on a macroscopic level, I was going into surgery seeing that. So
I will tell you, though, that there are those patients when they have that distal biceps or distal triceps rupture that it doesn't pass the smell test. You can kind of look at the guy and see, almost, I don't want to say any names, but certain baseball players who bulked up over a period of their career and hit more home runs in their late 30s than their early 30s. you can kind of smell and see that, well, you want to ask the question, have you cycled before? And invariably, again, trying to keep up with the competition or try to look good or look strong or look fit, they will take some extraordinary measures at times, and that is in itself a risk factor for those injuries. So talking about prevention, you can prevent those injuries, Steve, sometimes by just avoiding the use of those substances.
All right, well, we started there. We started with the triceps, but you've heard terms like rotator cuff, AC joint separation, Tommy John surgery. These are all common terms that we've heard before that we wonder what the effect is, and we wonder if it could happen to us. Dr. Rosenfield is going to tell us all about that when we get back. You're listening to the Injury Report on ESPN760.com.